So oftentimes as a social worker, we meet with patients who are worried not only about treatment options, but also about how they can continue to take care of their family, keep their job, and pay for their bills while they're in treatment. We hope to provide general information regarding programs that may assist you with healthcare costs. On this slide is our contact information if you're a patient here at the Swedish Cancer Institute. If you do not know who your clinic social worker is, the information line for each of the campus is attached. And if you're receiving care from another facility, you may want to reach out to your medical oncology team and ask to be connected to a social worker. Some clinics may not have social workers, but they have patient care navigators or case managers that can help. The American Cancer Society and Cancer Lifeline are also wonderful resources that you can connect with. Before we begin, I wanted to touch on the complexity of figuring out the cost of your treatment and why sometimes it can be difficult to navigate systems and figure out what resources are available to you. For the purpose of this webinar, we broke things down into two sections. So first, we're going to go over resources with direct medical costs, and then we will go over resources for indirect costs. So I wanted to make sure that the terminology is kind of clear. With direct medical costs, those are things that are a little bit easier for people to kind of figure out because they are costs that are associated with services that patients receive. So hospitalization, surgery, physician visits, radiation, chemotherapy, immunotherapy, they're all typically measured by insurance payments and also patient out-of-pocket co-payments and deductibles. The indirect costs are the ones that are a lot harder for people to calculate and navigate through, because those are the ones that are monetary losses associated with time spent receiving medical care, time lost from work, or other usual activities, lost productivity, emotional toll, and stress to the patient, family, and loved ones. There may be situations when you don't have insurance coverage because you couldn't afford it, your employer didn't cover it, you were healthy, and you didn't feel that you needed it, or maybe you're in between jobs. We have Swedish patient financial advocates that can explore the different options available to you and also explain a little bit more about the Affordable Care Act, which provides access to health insurance. Swedish also has a financial assistance program that ensures that financial constraints are not a barrier to receiving medically necessary care. Listed is the information for the Customer Service Center. If you do have health insurance, we encourage you to review your policy to find out what it covers and what you need to ensure coverage for your cancer treatment. We also encourage that you be organized, take notes, and ask questions if you do not understand. It may be helpful for you to learn the different terminology for what the insurance is using. Oftentimes, some people believe that co-payments, deductibles, and co-insurance are interrelated. And it's so helpful for you to figure out what that actually means with your insurance company. Also, it's been recent, but there's actually more insurance case managers that are being available to patients. That means that there's someone in your insurance program that can help you navigate and figure out how to interpret your insurance coverage. If you're denied coverage, you may want to start by asking your insurance company what you need to do to appeal a denial of coverage. We also wanted to let you know about the Statewide Health Insurance Benefits Advisors, often called SHIBA. This is through the Washington State Office of the Insurance Commissioner. They help understand your healthcare coverage options and rights. They provide free, unbiased, and confidential assistance with Medicare and healthcare choices. They help find affordable healthcare coverage and evaluate and compare health insurance plans. To learn more, please see the number and the online website listed. There may be instances where you may not have prescription coverage or your doctor recommended a treatment that isn't covered by your medical plan because it's under a clinical study. In this scenario, there may be clinical trials that your doctor could discuss with you. There's also times when your insurance isn't able to provide coverage for brand name medications, but because you've failed generic medications and you need brand name, you may be able to see if you can do an appeal to that decision and or apply for medication assistance programs that are listed. There may also be situations where your insurance is covered, However, you need some assistance with your copay. We've also listed these phone numbers and websites. We wanted to let you know about DSHS. There's many programs available through DSHS, including medical benefit, food program, cash benefit, and housing assistance. If you use this website, you can plug in your general financial information without having to put your actual name online to see what DSHS program you may be eligible for and how to apply. Medicaid is a jointly funded federal state health insurance program for people who qualify for financial assistance for medical expenses. In the state of Washington, Medicaid is called Apple Health. You may think that Medicaid and Medicare are the same. Actually, they're two different programs. Medicaid is a state-run program that provides hospital and medical coverage for people with low income and little or no resources. Each state has its own rules about who is eligible and what is covered under Medicaid. Some people qualify for both Medicare and Medicaid. Medicare is financed in part by payroll taxes paid by workers and their employees, and in part by monthly premiums deducted from Social Security checks. Medicare is health insurance program for people age 65 or older. Certain people younger than the age 65 can qualify for Medicare too. The program helps with the cost of health care, but it does not cover all medical expenses or the cost of most long-term care. The contact information for Medicare is also listed on this slide. We want to move into the section about indirect costs of cancer. And this one is a lot harder for people to figure out resources and also identify needs that they may have. But employment is one of the major considerations that people have. I wanted to highlight that your medical information is protected health information, and it's a personal decision why people disclose their medical condition to their employer and or coworkers. Sometimes people do not disclose information because they have a working environment where they're able to take time off easily and access benefits easily. However, there are times where people may disclose because they need to access programs and benefits through their employer. Sometimes people also disclose because they want support from their coworkers and or employer. The following slides are going to go into a little bit more about employment considerations and also resources that are available. Sometimes people face situations where they may need to talk to their employers to ask for reasonable accommodations. The ADA information line is a good resource to ask if you have questions in regards to public accommodations and also considerations about reasonable accommodations that you could ask through your employer. Again, I mentioned earlier that sometimes people access programs and benefits through their employer. There are some benefits that are not offered by the employer or the employee had to apply for within a window period of time. As we start talking about the different programs, what you need to remember is that there's different definitions of what disability is between your healthcare provider and what programs mean when you're discussing disability. So you want to make sure that it's very clear what that terminology means with each program. Sometimes people want to access short-term and long-term disability. Again, it can typically mean that short-term disability is a leave of absence for 6 months or less, whereas long-term is 6 months or more. You have to meet the definition of disability based on that program, and there may be a waiting period before your benefit begins varying on the plan. It may also not pay 100% of your income, but a certain percentage. There may also be additional employee assistance programs through your employer, which could include financial planning, counseling, or legal referrals. Some employers may also allow that you access donated vacation and sick time programs. There are certain criteria for this, and sometimes it requires that the employee is the one asking their coworkers for time, vacation and sick time off. So a lot of the times that may be a reason for someone to disclose to their coworkers why they need assistance. I wanted to let you guys know about the Family and Medical Leave Act, FMLA, which entitles eligible employees of covered employers to take unpaid job-protected leave for specified family and medical reasons with continuation of group health insurance coverage under the same terms and conditions as if the employee had not taken leave. There's information about the FMLA listed below. If you are going to take an extended amount of time off, one question to clarify through your employer is how long they can offer insurance benefits to you, or if they will be able to provide insurance through COBRA. It's important to know that there are certain circumstances where COBRA may not be offered. COBRA is a federal law that allows you and any of your immediate family members to stay on an employer-sponsored health plan under these circumstances. For example, if you lose or quit your job, you divorce the employee dies, or you are no longer covered as a dependent due to your age. Just as a reminder, you will be paying the entire cost of coverage, so whatever it is you used to pay plus the employer's contribution when you are on COBRA. So oftentimes it can be pricey. Here's information on where to go if you'd like to understand more about COBRA and specific laws. Social Security can be an entire course in and of itself, and unfortunately, we don't have a lot of time to cover everything, so I wanted to make sure to highlight some helpful information. There are 3 types of Social Security programs known to people, but because of how they're named, it can be very confusing for everyone. I think most of the time patients use the word Social Security, but they mean different things. So the 3 main ones that we're discussing is Social Security Retirement, which starts at the age of 62, Social Security Disability, which is SSDI, and you have to meet disability and work credit criteria. You also have to be disabled permanently due to medical, psychological, or psychiatric impairment. It has a 5-month waiting period from onset of disability, and you can apply if you've been on Medicare after 2 years on SSDI. The third program is Supplemental Security Income, SSI. Again, you must meet disability criteria. You have to be disabled for 1 year and financially needy. This is one of the situations where disability is very important, that terminology, because Social Security has very strict criteria on what disability means for them. I have the information in terms of how you can find out a little bit more about the specifics on these criteria below. I also wanted to come back a little bit and say that there are certain conditions that may be reviewed for compassionate allowances, which speeds up your approval process, but you still have a 5-month waiting period. In order to apply for Social Security, you can do this online or in person. Transportation. Transportation can be a huge concern for a lot of people getting medical treatment. Here are some of the resources that may be explored. The American Cancer Society has a Road to Recovery program, and with this, you will have to contact them directly as it depends on the different counties in terms of how they provide that service. There are also community-based volunteer driver programs such as Catholic Community Services. Angel Flight West is another program for those who are needing to fly to medical appointments. There's Medicaid brokers. There's also the National Patient Travel Center, which provides information about all forms of charitable, long-distance, medically related transportation and provides referrals to all appropriate sources of help available in the National Charitable Medical Transportation Network. Sorry about that. There may be situations where you need to travel to receive oncology care, and the American Cancer Society has a Hotels Partner program that you may be eligible for. Please contact them directly for criteria and eligibility. There are also some veteran benefits that may be available that does not go through your insurance, and we encourage you to be in contact with the VA regional office. And if you need further assistance, you may call this number to get additional help. Fundraising concerns. There are situations where you've maxed out employer benefits, healthcare benefits, savings, and everything else. Some people have elected to fundraise. Before you fundraise, there may be considerations such as trying to figure out if fundraising will actually affect or disqualify your benefits for Social Security, Medicaid, or any financial assistance programs that you are on. Also, you may want to offer tax-deductible options for your donors, and you need to figure out tax-exempt organizations and follow IRS guidelines. There are some people who have decided that they would like to fundraise in the form of having breakfast, lunch, dinner events, car washes, bake sales, or garage sales. And there are some people who have also elected to do some crowdfunding through some of these websites listed. Before you actually sign up with these websites, please make sure to figure out what the charge or fee for use will be. It's also really important to figure out if it's easy to withdraw funds or if you actually need to wait until the goal is met. I have heard from some patients that there are some crowdfunding websites that are a little bit easier to access in terms of withdrawing funds than others, and it's up to you which one you're comfortable with. Lastly, there's information about the Washington State 211, which is an easy phone number to remember that you can call for health and human service information and referrals and other assistance to meet your needs, such as rent utility assistance programs and foundations. To learn more, you can actually click on this website or call 211.